Welcome to this video presentation on ongoing patient care. My name is Florence Luganje, a clinical manager and a TOT for COVID-19. The objective of this module is to explain the process of ongoing care for patients being treated for COVID-19. Always remember to put on your PPE and frequently practice hand hygiene when interacting with the patients. We will now cover the technical aspects of patient care, primarily for those in the ICU on ventilators. What principles should be followed for ongoing patient care? 1. You should promote optimal communication. How? You should assess patients' ability to communicate and identify the patient's limitations. You can also use a non-verbal method of communication when required. Use of signals, signs, nodding, palm writing or lip reading should also be used. Provide paper and pencil for writing. Allow patients to respond and repeat explanations. Promote coping abilities for the patient and explain procedure every time to reduce anxiety. Encourage family members to verbalize after their feelings about ventilator and the patient's condition. Prevent trauma and infections. That is the second thing that we need to do. So how do we do that? The patient should be positioned with the head elevated to 30 degrees. You can also check for the position of the ventilator, ensuring that it should be such that there is minimum pulling or distortion of the interface to reduce the risk of trauma. Monitor cuff pressure at least once in every shift or as soon as possible. Pressure less than 25 centimeters of water. Tracheostomy care should also be done at least once in every shift and more frequently if needed. The third thing we should do is to provide oral care. Provide oral care every 2 hours with solutions that do not contain alcohol or lemon. Conduct suction of oral secretions, even as you assess for pressure areas at the corner of the mouth. Fourthly, ensure optimum level of mobility. Support active and passive range of motion every 6 to 8 hours to prevent contractures and venous stasis. Lastly, we should ensure a proper rest and sleep by keeping a calm and quiet environment for the patient, turning the monitor alarm down if possible, and providing dim light during light. You should also put side rails for the patient. When a patient is about to be weaned off ventilator, you should assess the patient for weaning criteria. You monitor the activity level, assess the dietary intake, and monitor results of the lab test. And also assess the client's and family's level of understanding of weaning. Explain that the patient may feel shortness of breath and provide encouragement as needed. Monitor the vital signs, the pulse oximetry, the ECG monitoring, the ABG analysis, and respiratory pattern continuously. Also, implement a weaning method prescribed by your doctors and other authority. Ensure that you maintain patent airway and suction the airway as needed. Monitor ABG level and pulmonary function test as per requirements. Terminate the weaning if adverse effects occur.